Every year, 55 million eye injuries occur globally. This staggering volume creates a massive financial burden, costing tens of millions annually in emergency healthcare and lost productivity. But looking closely reveals a clear pattern. 90% of these injuries are completely preventable. While strict workplace safety regulations ensure high compliance on job sites, domestic negligence remains high. Only 12% of people wear protective eyewear when doing DIY projects around the house. Global ocular trauma is rarely an unpredictable accident. It is overwhelmingly a systemic failure of basic preventative human behavior. The demographics reflect this behavior. Young men between the ages of 20 and 44 account for roughly 90% of all work-related eye injuries. This chart breaks down exactly where these incidents happen. You can see that work environments account for 32 to 60% of cases, but home environments follow closely behind, causing 24 to 47% of these injuries. Yet the hazard isn't limited to heavy industry or power tools. A significant portion of severe eye trauma occurs in women over the age of 65, strictly resulting from falls. Inside the home, the causes are surprisingly mundane. People suffer abrasions from gardening, from simple paper cuts, and slips with mascara wands. The risk of severe trauma is often a byproduct of our collective lack of perceived danger in familiar, everyday environments. Zooming into the physical eye, we find that mechanical impacts, blunt force or flying debris, cause over 70% of all cases. The most frequent result is a corneal abrasion, which is essentially a physical scratch across the clear front surface of the eye. Even a microscopic scratch here generates intense pain, tearing, and light sensitivity. This is a result of the cornea's dense network of nerve endings, which magnifies the physical sensation of even the smallest injury. The second major category of injury involves foreign bodies. These are small particles, often metal shards from grinding, drilling, or milling, that become physically embedded in the ocular tissue. Once an iron particle embeds in the damp environment of the eye, it reacts quickly. Within a matter of hours, the metal oxidizes, creating a toxic layer of rust, known clinically as Coates' white ring, that infiltrates the surrounding cells. The eye's delicate, highly innervated biology turns ordinary debris into an immediate, painful biochemical threat. Because the cornea is entirely transparent, locating microscopic damage requires specialized diagnostic techniques. Clinicians use sodium fluorescein, a specific dye that pools into any disruptions on the eye surface. When illuminated with a cobalt blue light, the dye glows bright green, mapping out the exact shape and depth of the scratch. This dye is also used to check for something far more critical, cidal sign. This is the primary visual indicator of a full-thickness, penetrating wound. If the physical structure of the eye has been punctured, the internal fluid, called aqueous humor, will leak out. As it escapes through the wound, it physically washes away and disrupts the even glow of the green dye. Detecting cidal sign instantly escalates a routine exam to a surgical emergency, confirming that the globe's structural integrity has been breached. If the globe is intact but a foreign body remains embedded, resolving the injury requires physical, mechanical extraction directly from the cornea. In this office-based procedure, clinicians use tools like a standard 25-gauge needle to gently tease the metal shard up and away from the tissue. If a rust ring has formed, they use a small spinning drill called an auger brush to scrape the oxidized cells away. Once the debris is gone, the newly exposed tissue is highly vulnerable. Patients must immediately start a regimen of broad-spectrum antibiotics, like chloramphenicol, to prevent opportunistic bacteria from causing a secondary infection. Treating the initial trauma requires an invasive manual intervention that creates a secondary controlled wound, just to clear the hazard and start the healing process. Even after that wound heals, patients can face a debilitating long-term complication known as recurrent corneal erosions. This happens when the newly regenerated surface cells fail to form strong structural bonds, called hemidesmosomes, with the underlying Bowman's layer. The adhesion fails, leaving the outer skin weak and unstable. Managing this requires prolonged therapies, like sleeping in medicated ointments or wearing continuous bandage contact lenses to physically shield the fragile cells. These are months of painful clinical interventions, invasive scraping, and structural cellular failure.